All, this is Mobeen Sayed from drbeen.com. Welcome to one more show. So yesterday, when we talked about this study or the data from Israel, there were a number of questions that said that I did not look at the absolute numbers of severely ill hospitalized patients, and that's a fair thing to say. I wanted to make sure that we can look at that data in absolute numbers as well and make sense of it. That is one. The comment there was, in absolute numbers, the hospitalized patients are more vaccinated than those who are unvaccinated. So I wanted to make sure that we can look at that number and understand what does that mean. That is one. Secondly, so this is really an addendum to the discussion yesterday. Secondly, there is a preprint study from Vietnam, and that study is about the Delta variant viral load in healthcare vaccinated workers with AstraZeneca. And there has been a lot of discussion around that. In some cases, the discussion has been that the Delta variant causes, and this is actually an incorrect statement that I'm going to speak here, Delta variant causes greater viral load in vaccinated compared to unvaccinated. This is the common statement stuck with this study, and it is an incorrect statement. So I'm going to look at the data together with us to see why this statement is incorrect and what are authors actually presenting. So with this, let's start. I hope you're all doing good. And let's rock and roll. So here, once again, I'm going to keep this writers, I think. So somebody was correcting me yesterday that it is not routers, it is writers. So apologies for yesterday, writers or Reuters. So Israeli doctors find severe COVID-19 breakthrough cases mostly in older, sicker patients. And there is a statement here. This statement is something that has been going around as well, and that is half of the patients. So if you read here, around half of the country's 600 patients presently hospitalized with severe illness have received 2 doses of the Pfizer shot, a rare occurrence out of 5.4 million fully vaccinated people. And this is the date is August 20. So a few days ago. I would expect a similar number as well, and we'll look into that number in a second. The second thing that I would like to keep us as a context in our mind is the total population which is aged 60 plus in Israel. So this is 2020 data, age 60 plus, 1.424 million or 1.4 million, about 1.4 million. Good. So that number is important to keep in mind because 90% of this number are vaccinated, and the vaccinated hospitalized are out of that number compared to unvaccinated hospitalized, which is out of the remaining 140,000. So it is kind of not the entirely correct thing to compare them absolute number to absolute number, and we'll see that in a second. This is the English version of the data from Israeli Health Ministry. This is their Hebrew version. I requested David, my friend from Israel. He actually did a Zoom call before this talk and walked me through some of the data. So we're going to look into that. And this is the study from Vietnam, which I was mentioning. This is a preprint in Lancet. This is not a fully published study yet. So let's start having our discussion here. So look, hospitalization or severely ill patients data. The comments that I received were more vaccinated people are hospitalized as compared to unvaccinated. We should look at the absolute numbers instead of just the rate. And I'm going to now look at those numbers and then go back to why we should use the rate as well. So 60 plus population of Israel is about 1.424 millions, correct? 90% of that is vaccinated, too short vaccinated. And how did I get that number? Let's look at that. So here, I'm going to increase the size of this one, and I hope it would not break on me. So if I go to this data, so if you see this, I'm only going to use dose 2 data. We can use dose 3 as well. And if you hover, check this side out, 60 to 69, 70 to 79, 80 to 89, plus 90. So we want to see 60 plus, correct? That is the majority that is in the hospital. So 60 plus, look at this number, 60 plus. Look at 2 doses. I'm not counting boosters. 87%, 87.7% are vaccinated. So whatever this number is, we know that from 60 to 90 plus, the total number is about 1.424 million. So there is a division, further breakdown of the numbers here, but I do not know those numbers, and I don't think it matters because it is 60 plus in hospitalization. That is the number we're going to look at. So 87% here, 93% here, 92% here, and 90% here, 91%. So I think that if we average them out, they would be somewhere about 90. This is my mental math. It may be give or take a few numbers. Of course, it's going to be between the 87 to 94, right? So the number is there. So I took 90. 90% are vaccinated. That means about 1.26 million people are 60 plus and vaccinated. And 140, the remaining people, 140,000 are unvaccinated and 60 plus. And so that number is 10% of the 60 plus population. Then what I did was I looked at 1 day. So if I go back here and look at 1 day here, let's say, and this was the chart for which there was a comment that I did not look at the absolute number. I'll tell you why I did not look at it. I could not understand what did patients are difficult for 100K people. What did that mean? I think it's a translation issue. So David helped me today to understand what it meant. My suspicion was this, but anyways, he clarified it. The clarification is this. These numbers up here are absolute, and the numbers down here are out of 100,000. And we'll see what does absolute give us, and then what does rate per 100,000 mean. So I'm going to go to age 60 and above absolute numbers. And I'm just going to take 1 day. So let's say this day, 25th of August. Look at the numbers. Unvaccinated, 214 hospitalized. I'm leaving the partially vaccinated. You could add them to vaccinated if you like, or unvaccinated. I would just leave them out from both groups. Fully vaccinated, 257. So of course, when you look at this number, absolute number, then it is correct that 257 fully vaccinated folks are in hospital and 214 fully vaccinated are in the hospital on this date. Correct? So if you count them all, 214 plus 257 plus 13, almost 600. Or 250 plus 250, 500 something. So out of these 500, it is correct that majority is fully vaccinated. However, why percentage or the rate is important is that look at this number here. Look at it in context. Out of 1.26 million people, which are 60 plus and vaccinated, there are 256 on that date in the hospital. compared to out of 140,000 people, 214 on that date are in the hospital. That means you cannot just compare them one by one. You have to look at their ratio to understand what is really comparative number. So if you see, the ratio should be 19.4 per 100,000 on the vaccinated side. So how do we read this? We'll say 60 plus vaccinated per 100,000. The cases, severely ill cases, are 19.4. On the other hand, 60 plus unvaccinated, out of 100,000, the rate is 265. So that is how you look at the rate or compare them. You can take the percentage as well. So you can say out of 140, what is the percentage of 214? And then out of 1.26 million, what is the percentage of 256? And then do the rate. So you can take percentage, you can take the rate, but either way, what you would realize is that one population is a very large population, 1.26 million versus 140,000. Their absolute numbers cannot be compared without normalization. So this is why when a newspaper says 300 hospitalized vaccinated and 300 hospitalized unvaccinated is a cause of alarm, of course, even a single person hospitalized is a cause of alarm. But these two populations are not equal. So that is what I wanted to share. And I know, considering the kind of comments I've been getting, it seems like somehow the feeling is that I am trying to say that the vaccines are working when they are not working. I spoke with David and I said, what do you think? And his opinion, he was thinking aloud with me. We both may be wrong. But one of his thinking was that at one point, Israel said, we are done. We've gotten the pandemic under control. We've gotten people vaccinated. We are beyond any issue. And I think we all remember those news cycles where there was no new cases from Israel. And we said, hey, look, Israel is done. They're out of it. And then the cases started surging again. And so the number of cases, when you look at them between vaccinated or unvaccinated, they are almost equal. So when you look at the infection, number of people infected, then it seems like there is no difference. And that is where when the authorities said, hey, we are out of it, or when Pfizer said, very, very efficacious, that is where it didn't work. And I think we will agree here that I had been saying for months that there is no vaccine that would stop a respiratory virus, to say you cannot land in a person's mouth or nose and you cannot replicate there. And then Delta is faster. So within a couple of days, it actually causes more damage, even if the person is vaccinated and while the immune system is booting up and going to attack that. So it was possible to have infections. The message probably should have been that, hey, severely ill and hospitalized or death, that is where there is more protection. So I think there is a communication issue. That is what David was presenting. And he said, maybe I'm wrong, but this is what I was thinking. If I go down here, so if you look at, one second, if I go back to this one, so that means in this chart, you can look at the numbers in both ways. You can look at the absolute numbers, or you can go here and look at the rates as well. So these are the rates. And you can see those rates here as well. So if you see here at a rate per 100,000 active patient, if I go to seriously ill patient, then this is what you see. So they have actually given down the brackets of age, which I put them all together, 60 plus. Here they actually have those brackets, and I went through them yesterday. For example, 60 to 69, This is, once again, it is rate out of 100,000. If you felt that rate is not something I want to have the absolute number, you can look at the absolute number and look at this 60 to 69 absolute number, fully vaccinated more than the vaccinated, unvaccinated. But once again, you also have to see 60 to 69 fully vaccinated are a larger group, and unvaccinated is a smaller group. So I wanted to make sure that we can look at this correctly. Here is the Hebrew version of this. Now I'm going to switch gears towards the study from Vietnam. This is a preprint, and the credit for this study is to Ray Walker. He actually shared it with me on WhatsApp this morning. It was interesting. What is more interesting with this is that the statement with this study that has been circulating in some areas is the following. Folks are saying viral load, delta viral load in vaccinated individuals is greater compared to the viral load in unvaccinated individuals. And because the study uses the term breakthrough, and they say we are looking at the breakthrough, the whole statement then morphs into saying Delta is causing more infections in vaccinated folks through breakthrough compared to unvaccinated. And this statement is incorrect. And I'm going to look at this once again. I know that when I do these discussions, if I discuss something where I point out a weakness in a study that is not on the right track for the, let's say, this study will show that some messaging here that may be interesting for folks who do not want vaccine is incorrect, then they go and complain about me and report me. And there are studies which I criticize, which are pro-vax folks use them. And when I criticize them, they criticize me and report me in return. My teacher called me and they said, somebody reached out to them and said, Mubin is not a doctor. And he said, I laughed and I told them that I am actually his teacher. And he has been on these shows as well in the past. And this is just a minor one. There are more serious complaints and allegations that people have been making nowadays. And that is just out of their own egos and their own, they think it is interesting that if their ego is hurt because I did not say what they want, then it is actually okay for them to try to shut down the whole thing so nobody takes any benefit. So there are people like that. I accept it. Okay, so let's look at the Vietnam study. This study says the following, the preprint once again. They compared the viral load between 11th to 25th June of 2021 in hospital staff who was vaccinated, and the vaccination was the second dose of the vaccination was 7 to 8 weeks ago, which I love it. If some study is going to look at the effect of a vaccine, it is actually interesting to either look at it after the vaccine continuously for many, many months, like UK study, or at least start looking at it 7 to 8 weeks after, so that you can see what is the behavior of the antibodies at that time or the immune system. So the study is, they took 65 healthcare workers. They knew when they got vaccinated, and the vaccine was AstraZeneca. And then they started measuring their antibodies, PCR, when they became infected. So they followed them to see will they get infection. And when they got infection, then they started looking at their antibodies and so on. So what did they do? They saw out of these 65, there were 49 pre-symptomatic patients. One of them needed oxygen. All of them recovered eventlessly without any issues. So healthcare workers, 65 total. So small study, preprint. They gave them AstraZeneca. Then they started observing them to see if they will get the infection. One of the purpose of the study, the author said, was to say within the vaccinated community, can the virus spread? And they said, we saw that the virus spread in these 49 people. And they did the sequencing of the virus, I think, on 23 people. And they said that the Delta virus sequence, or the variant of the Delta virus, in all of them was similar. And it was different from the society of the remaining community, which meant this was within this hospital staff, within this community, it was transmitting, the virus was transmitting. So that is interesting that they did. So what they did was they took 23 genomic sequences. They were all Delta. And these Delta sequences were even more typical within that community, and it was different from the community outside. And please remember, it is not necessary that Delta is same everywhere. Every time somebody becomes infected, they actually give rise to even more variations, and those variations are either a subset of the bigger variation, or they can become their own variation as well, like Delta is. So here is what they saw. They saw that when they took the PCR, or the nasopharyngeal swab, from the nostrils of these patients, and they detected the SARS-CoV-2 in there, they could go only, let's say the median was 16 cycles, the cycle threshold, right? The duplications, just 16 was sufficient to produce a positive result. That means the viral load was high enough that they did not have to duplicate it again and again and again. So 16 was sufficient. Compared to in last year, March to April timeframe, whatever variant was at that time, some original Wuhan-like variant. And they said at that time, the cycle thresholds used to be higher. That means viral load used to be less. So here they saw that the viral load, and how much more? They saw that viral load was 251 times higher. This is where folks have actually created this confusion as well. And that is, the message went out in the street to say, in the vaccinated people, the viral load is 251 times higher compared to unvaccinated. And when somebody says, well, this is really not comparing the vaccinated, unvaccinated, it is vaccinated versus last year's March and April, the answer to them has been, well, nobody was vaccinated then. So it is really a comparison of that. Actually, if that comparison had to be done, the comparison should have been Delta in vaccinated and the viral load of it versus Delta's viral load in unvaccinated now. So if the comparison had to be between vaccinated and unvaccinated and the loads there, then they should have taken the groups here now instead of comparing with the March or April. And that is what was not the author's intent. This was just a kind of misrepresentation that was created. So what they saw was, compared to old strain, March, April 2020, the Delta strain created in vaccinated people 251 times more viral load. There was another interesting thing that they saw. In the asymptomatic patients, so out of all of these who became infected, some of them became symptomatic and some were asymptomatic. In the asymptomatic patients, the viral load was similar. That is a very interesting new thing for me at least. I had been under the impression that asymptomatic patients are handling the virus better with the innate arm. So overall agreed that there will not be a lot of viral load because innate arm would just start slashing it right away. But I could not imagine that a Delta-like variant, which is rapid, could be taken care of by the immune system that may be innate arm only or innate plus the adaptive arm. Authors did not comment on that. This is me commenting. but patients were asymptomatic, then the load was not high. And it makes sense though. If the load is not high, that means there is not a lot of tissue damage. That means there will not be a lot of symptoms. So delta asymptomatic patients have a low viral load. That's very interesting observation. Then this is also something that was totally new for me. I loved to understand this because this was a question in my mind for some days. And the question was, fine, the delta very rapidly causes tissue damage, replicates very fast. Does it clear out fast as well? Does it go away fast as well? Does it come in 2 days and go out in 5 days? So they answered this question. Again, small study, preprint, but this is an interesting comment they've made. They said from the diagnosis till the PCR negative, the times have been, some people recovered in 8 days from diagnosis to PCR negative within 8 days, some in 33 days. 33 days for delta to stay positive in a vaccinated person. And then 21 days was the median. 21 days delta stays on in a patient who is vaccinated. I do not know, we don't have that data here, how many days in an unvaccinated it might continue. My suspicion is maybe similar, but I do not know. Why do I say maybe similar? Because the immune system responds in a similar way. It is not that in an unvaccinated person, the immune system is just not going to respond. It is going to respond. Yes, the beginning of the response may take longer period of time. But once the response starts in a healthy person, they would clear out the virus as quickly as possible. Maybe they have a slightly prolonged duration. I do not know. This is interesting. I did not know this data before for Delta. 8 days to 33 days, median clearance time, 21 days. Are they shedding during that time as well? So they did not say it. My thought is, if they're looking at a variant that has a 251 times higher load, at least in the symptomatic, then they would be shedding as well, because symptomatic means they may have cough or sneezing or runny nose or such things. That means they may be shedding more than asymptomatic maybe. So this is also an interesting outcome of this study. Then this is very interesting. They make a statement, and I'll show it to you in the document, which is very, very interesting and interesting to interpret as well. Neutralizing antibodies in vaccinated patients at the time of diagnosis. So let's say I'm vaccinated, AstraZeneca. I just got the infection. You took my antibodies at the time of diagnosis, and I don't have a lot of neutralizing antibodies. It does make sense though, because I got infected. That means I didn't have the system helping me. And they said the neutralizing antibody count was even lower than the control uninfected individuals. That is what I cannot reconcile. The uninfected individuals should not have the neutralizing antibodies, but still the titers could come back positive for test kits reacting with the antibodies, other antibodies. But what is this interesting thing over here? That patients' neutralizing antibody level is showing lesser than the uninfected person's controls neutralizing antibody, and I'll show you in the document. However, in the same paragraph, they also say, or in the same discussion part, they also say that within 2 to 3 weeks then, after the diagnosis, the neutralizing antibodies significantly increase. And how much increase? They say at the diagnosis, let's say this is 0%. Within 3 weeks, the percentage goes up to 65%. patient actually mounts a response. And then finally, their conclusion was that, hey, just the vaccine is not sufficient, continue to have social distancing, wear mask, and continue to be careful. They were not looking for hospitalization, they were not looking for death. The study is small, everybody recovered fine, so that extra data is not here. They also did not compare it to infected, unvaccinated, and the delta load in them. That was not also compared. So this comparison to say that, hey, I'm going to take delta in vaccinated and then compare it to March of last year and say that was unvaccinated. Well, the variant at that time was not a fast variant either. So you are now playing with two variables, and that does not, work very well. Okay, so this is what is also very, very interesting for me. Now let me show you some of the data here. Just a quick overview of what is in the document. Some things I highlighted. Let's go. So 1st August, they are looking at the breakthrough infections up till 1st August. Then they said they have looked at various studies, and there are some gaps in the studies which they try to fill with this study. This study was 11th to June, 11 to 25th June. They captured the infected cases at a very early phase of infection and carefully followed them during hospitalization to assess the kinetics of viral load and neutralizing antibodies and the development of clinical symptoms. So beautiful study, small study. 49 to 62 cases were pre-symptomatic. There are some spelling mistakes, and there it is a preprint. I'm sure that they would fix it. All recovered eventually. 23 sequences were done, all delta. Then here, during the course of infection, peaks of viral load measured at any time point of symptomatic cases were higher than that of asymptomatic cases, equivalent to median log this and copy. So they've given that data. Then here, 251 times higher compared to last year's March and April timeframe. And they did not use the vaccinated or unvaccinated. That just became a rumor from the study. Here is how they articulated, the authors. They said, compared with peak viral load of cases infected with old SARS-CoV-2 strains, and they did not even try to create the confusion. They didn't say delta here. They said old strains. In Vietnam, between March and April, peak viral loads of breakthrough cases were significantly higher. Median log 10 viral load in copies per milliliter, 9.1, equivalent to 251 times higher for median viral load. That is, delta was higher. The difference were more profound among symptomatic cases, while there was no difference in viral loads among asymptomatic cases between the two groups. This is very, very interesting. Then this is also very interesting. Neutralizing antibodies at week 2 and 3 after diagnosis, neutralizing antibodies levels of the case patients significantly increased and were higher than neutralizing antibody levels measured at week 2. So the immune system started making the antibodies and they kept increasing. Of course, that is when the patient would start recovering. Antibodies would increase, they would fight with the virus, they would remove the virus, and patient would start feeling better. So as the patient is recovering, antibodies are increasing, viral load is going down. 10 patients had data on neutralizing antibodies measured at both 2 weeks after the second dose and at diagnosis. So at the time of diagnosis, they measured the antibodies. Then 2 weeks later, they measured the antibodies as well. Neutralizing antibody levels measured at these 2 time points of the 10 case patients were significantly lower than those in the 30 matched uninfected controls. Think about that. Vaccinated and infected, and the neutralizing antibody levels are lower than uninfected control. I can't explain it. Uninfected control are not supposed to have them. So again, I cannot. I have to do some more data analysis and study of this. And finally, AstraZeneca. Many people have been asking, because somehow in there, I believe in this study here, they probably did not write AstraZeneca in the here, or maybe they have written it. Yeah, so I think it did not come across clear here. So people were confused at which vaccine. So Oxford AstraZeneca. So this is the discussion for today. I hope it clarifies some of the confusion that has been around these two data sets, and one data set and one studies. Let's do this. I'm gonna take a 5 minutes break, and then let's do a quick chit chat as well. Thank you.